Welcome to The Explainer. So glad you're joining us, because today we're tackling something literally everyone has to deal with as soon as the temperature drops, the dreaded winter cough. You know the exact feeling I'm talking about, right? The air gets crisp, holidays are right around the corner, and suddenly it seems like half the people you know are coughing, wheezing, and just totally bundled up with some respiratory bug. But here's where things get kind of confusing, even for the most informed patients and parents out there. When that cough settles deep into your chest, is it actually an infection of the big airways or the small ones? Knowing the difference isn't just some medical trivia. It fundamentally changes how we treat the illness and protect our lungs. So wrap up warm and let's clear up the central confusion of the winter lung dilemma.
Okay, let's dive right into this. Bronchitis or bronchiolitis? I mean, these two words sound incredibly similar, don't they? They're literally just one letter apart. But they are entirely distinct conditions affecting completely different parts of your respiratory system. To really picture this, I want you to imagine the human lung as an upside-down tree. So the windpipe is your main trunk, and that branches off into two large limbs. From there, those limbs split into smaller branches and eventually into tiny, delicate little twigs at the very edges. Depending on exactly which part of this upside-down tree is actually inflamed, well, you get a completely different illness, which requires a totally different approach.
So looking at bronchitis first, this is inflammation striking the large and medium-sized airways. Think of those thick, sturdy branches of our upside-down tree. It's incredibly common across basically all age groups, from young adults right through to the elderly. But then there's bronchiolitis. Notice that IOL right in the middle of the word. This condition targets the bronchioles, the absolute smallest airways, those super fragile twigs at the far edges of our lungs. And because these airways are just incredibly narrow to begin with, bronchiolitis almost exclusively poses a threat to infants and toddlers under 2 years old. The respiratory systems are simply just too small to handle the swelling.
Let's shift our focus back to those larger branches for a second and talk about acute bronchitis. You probably know this by its much more common everyday name, the chest cold. When you have a regular cold or an upper respiratory thing that suddenly moves down deep into your chest, this is usually exactly what's happening. Your large airways get inflamed, and the main symptom is this hacking cough that often brings up mucus. You might even experience some wheezing, shortness of breath, and maybe a mild fever. Now, what's absolutely vital to understand here is the timeline. The fever and the fatigue, those might fade in a few days, but that pesky cough, it can persist for up to 3 weeks, and in some cases, crazy as it sounds, even up to 6 weeks. It's just a lingering, incredibly frustrating annoyance.
But here is the absolute most crucial statistic you need to know about acute bronchitis. 90%. In over 90% of cases, acute bronchitis is caused by a viral infection, things like the rhinovirus, influenza, or coronavirus. So why does that number matter so much? Well, because antibiotics absolutely do not kill viruses. They only kill bacteria. But despite this being an undeniable medical fact, data shows that more than 10 million people in the US visit a doctor for this exact condition every single year, and roughly 70% of them end up walking away with a prescription for antibiotics. Those antibiotics are entirely ineffective against a viral chest cold, and using them when you don't need to can actually cause side effects and promote antibiotic-resistant bacteria. It's a huge issue.
Now, let's pivot back to those fragile little twigs of our lung tree, bronchiolitis. This is a totally different beast, and honestly, it's a massive source of anxiety for parents of newborns and toddlers. This condition is driven primarily by RSV, the Respiratory Syncytial Virus. When RSV infects a baby's tiny bronchioles, it causes really intense swelling and a huge buildup of mucus. And because an infant's airways are already pretty much microscopic, that swelling severely restricts their airflow. If you're watching an infant with this, you really need to look out for rapid breathing with short, shallow breaths, grunting noises, and this high-pitched whistling or wheezing sound. The most alarming sign of severe distress is something called retractions. That's where the baby is working so incredibly hard to pull in air that you can actually see the skin around their ribs sucking inward with every single breath. If you see that happening, or if you notice bluish lips indicating low oxygen, that is an immediate medical emergency, no question.
So, because these two conditions, the adult chest cold and the infant threat of bronchiolitis, both involve coughing and both happen during the winter, parents and patients constantly mix them up. And when we confuse the illnesses, we end up seeking out completely the wrong remedies. This leads to frustrated adults demanding antibiotics they literally do not need, and terrified parents trying to use asthma medications on babies, which actually won't help clear that viral mucus blocking their tiny airways. We really need a major reality check on how we treat these viral winter lung dilemmas.
Now, what's really interesting about this slide is how it busts some major respiratory treatment myths. If we look at the don't do this column, we've already established antibiotics are a total no-go for these viral infections. But notice the second point there, routine albuterol inhalers. Albuterol is an asthma drug. It's designed to relax muscle spasms in the airways. But the wheezing you hear in bronchiolitis, that isn't caused by muscle spasms. It's caused by a physical blockage of mucus and swelling. Because of that, medical guidelines strictly state albuterol is not routinely recommended because it just doesn't fix the underlying plumbing problem. Also, over-the-counter cough medicines, not recommended for young children under 6. Instead, we really need to focus on the do this column. Plenty of rest, heavy hydration to thin out that mucus, managing fevers with acetaminophen, and for babies who are obligate nose breathers, by the way, gentle nasal suctioning to clear a path for oxygen.
Up to this point, we've really focused on what happens when a virus successfully invades your respiratory tract. But what about active prevention? How do we protect our perfectly healthy lungs when we step out into that freezing winter air? Well, before you lace up your sneakers for your next winter jog, or, even just take a brisk walk down to the bus stop, it's absolutely crucial to understand how the winter environment itself acts as a physical stressor on your respiratory system.
So the crucial point here is understanding a physiological reaction called the bronchospasm. Normally, the moist lining of your nose and mouth acts like a built-in climate control system. It actually warms and humidifies the air before it ever reaches your delicate lung tissue. But when you're outside breathing fast and heavy in the cold, that dry, freezing air entirely bypasses your body's conditioning system and hits your lungs directly. And guess what? Your lungs interpret this freezing, dry air as a noxious, dangerous substance. In an absolute panic, they forcefully constrict, they spasm to try and block the irritant. This natural protective mechanism leads to immediate chest tightness, coughing, and shortness of breath, which, as you can imagine, is especially dangerous if you already have pre-existing asthma.
But hey, do not let the cold weather keep you trapped inside. You just need to proactively condition your air. First things first, warm up your respiratory system indoors before heading out into the freezing temps. Just breathe deeply in a cool but not freezing hallway to help your lungs transition. Once you're outside, make a conscious effort to inhale through your nose, not your mouth. Your nose is expertly designed to warm and moisten air, your mouth just isn't. It also really helps to create a sort of microclimate for your face. Wear a moisture-wicking mask or a scarf right over your nose and mouth to trap a small little bubble of warm, humid air to breathe from. You'll also want to hydrate heavily beforehand because dehydrated airways are incredibly prone to spasms. And finally, try to avoid smoggy routes. Cold air combined with pollution is basically a double whammy irritant for your bronchi.
Let's move to a really cool concept and see how this builds actual lung strength. Because beyond just conditioning your air, you can proactively train your respiratory muscles. I mean, you wouldn't run a race without training your leg muscles, right? So why ignore your lungs? This is a fantastic, interactive technique from Harvard Health called diaphragmatic breathing or belly breathing, and it drastically improves respiratory function and efficiency. Let's actually walk through it together. First, lie flat on your back with your knees bent. Place one hand on your upper chest and the other right on your stomach. Next, breathe slowly and deeply through your nose. Now the trick here is that the hand on your chest shouldn't move much at all, but the hand on your belly should actively rise as your lungs expand fully downwards. Finally, tighten your abdominal muscles and exhale completely through pursed lips, watching your belly lower back down. Practicing this actively trains your lungs to inflate to their absolute maximum capacity.
We have covered a massive amount of ground today, from untangling the confusing web of viral chest colds and infant bronchiolitis, to busting some pretty stubborn medication myths, all the way to actively defending your airways against freezing temperatures. You now have the blueprint to protect your respiratory system. The power to breathe easier this winter is entirely in your hands, whether you consciously decide to breathe through your nose, wrap a scarf to create that warm air bubble, or perhaps train your diaphragm. Thank you so much for joining me for this explainer. I really hope you found this breakdown of the winter lung dilemma both fascinating and highly actionable. If you enjoyed this structured dive into the facts, please leave a like, share this with a friend or a parent who might really find it helpful, and definitely don't forget to subscribe for more clear, slide-based learning. And of course, take a quick moment to check out the clinic link provided for any physical therapy or emergency pain relief treatments you might need. But before we go, I want to leave you with this. What is the very first thing you will change about your winter routine tomorrow morning to protect your lungs? Stay warm, stay healthy, and I will see you in the next explainer.